Symptoms of bone cancer in women. There are more than 70 types of bone cancer, and its treatment varies depending on its type and location. It usually affects adolescents, young adults, but it may also occur in young children. Bone cancer affects bones and soft tissues, which include muscles, fat, blood vessels, tendons, and joint lining. Primary bone cancer begins in bone cells. This is different from secondary or metastatic bone cancer, which spreads to the bones from other places in the body. Today we find out the causes and symptoms of bone cancer in women. Where does bone cancer spread? When primary bone cancer begins to grow, cancer cells multiply and begin to break down bone, weakening the bone in that area. Bone cancer cells can break off from the primary bone tumor and travel to other organs, usually to the lungs or other bones, where they can grow into secondary tumors. What are the causes of bone cancer? Some factors that can increase your risk of bone cancer include previous radiation therapy, especially for people who received high doses at a young age. Other orthopedic conditions, such as Paget's disease of bone. Genetic factors, such as inherited conditions such as Li-Fraumeni syndrome, and a strong family history of some types of cancer. Where does bone cancer start and what are its types? There are many signs of bone cancer. Primary bone cancer begins in bone cells. Doctors sometimes use the term osteosarcoma when they talk about primary bone cancer. Sarcomas are cancers that begin in any connective tissue in the body. This includes bones, but also includes muscles, tendons, blood vessels, adipose tissue. There are many different types of primary bone cancer, and perhaps the most common types are osteosarcoma, most common in the upper arms or legs, usually around the knee. Chondrosarcoma, most often found in the pelvic bones, including those that form the hip joints, shoulder bones, thigh bones, or ribs. Ewing's sarcoma, which often begins in the pelvis, thigh bones, shoulder bones, or ribs. Other rare types of bone cancer include spindle cell sarcoma, which is more common in the bones of the legs. Chordoma, which usually begins in the bones at the bottom of the spine, sacrum, the bones vertebrae in the back vertebral column, or the bones of the face and skull. You may be interested in learning about the causes of osteoporosis and natural treatments. Myeloma. People sometimes call it bone cancer, and it develops from cells in the bone marrow called plasma cells, but it is not a type of primary bone cancer. Because it doesn't start in the bone itself, so if you have myeloma, your treatment will be different. Signs and symptoms of bone cancer. The most common symptom of bone cancer is pain in the bones and joints, which may be worse at night or during activity. Other symptoms may include swelling in or near the affected part of the bone, bone pain, hardening or looseness of the bones, movement problems, unexplained weight loss, bone fracture, loss of sensation in the affected limb, fatigue and tiredness. The spine cord can put pressure on the nerves emerging from the spinal cord, and this can cause numbness, tingling or even weakness in different parts of the body, depending on the location of the tumor. If the cancer spreads to other organs, it may also cause other symptoms. For example, if the cancer spreads to the lungs, it may lead to coughing or difficulty breathing. But it should be noted that bone cancer is not common, and the symptoms it can cause are likely due to other conditions, such as injuries or arthritis. However, if symptoms persist for a long time or get worse, it is important to visit a doctor, so the cause can be found and treated if necessary. If you like this information, please hit like, subscribe and share button.